My name's Sydney Wadden, and I'm going to be doing this presentation on perinatal mood disorders, and then focusing a little bit more into postpartum depression. Perinatal mood disorders are mood disorders that develop during pregnancy or within the first year of the infant's life. These mood disorders can include anxiety, OCD, psychosis, and depression. The example of perinatal mood disorder that I am going to discuss throughout this presentation is postpartum depression. Postpartum depression is an intense and pervasive sadness with severe, liable mood swings. The affected mothers can experience intense fears, anxiety, anger, and despondency, which persist for longer than a few weeks post-delivery. Postpartum depression affects about 13% of mothers in Canada and is about 2 times more prevalent in mothers of minority and marginalized groups, such as Indigenous and immigrant mothers. Some key risk factors associated with postpartum depression are low socioeconomic status, low education, previous history of mental illness, preterm delivery, interpersonal violence, poor support system, young maternal age, immigrant status, and high stress during pregnancy. As a nurse, using Caritas praxis to deepen understanding of the patient's experience is an important step. The Caritas process I would utilize involves allowing and supporting the expression of positive and negative thoughts. This is an important step in creating a therapeutic nurse-client relationship and ensuring the client is comfortable in sharing their feelings. As the nurse, I would complete a general survey to initially evaluate the client's mood and emotional status. A general survey begins as soon as you enter into the exam room. When entering an exam room with the client, creating an initial assessment of the client's status will help to steer the direction of your interactions. Is the client smiling, or do they look sad? Do they look like they've been taking care of themselves, like is their hair washed, or are they wearing clean clothes, that kind of thing. The answer to these questions can be helpful when trying to evaluate how a new mother is adjusting to life with an infant. Based on this initial assessment, I will choose my tone of voice and choice of words appropriately. This will help the client to feel more comfortable and show the client that I am authentically present and attentive to their body language and actions. I will also ask open-ended questions and allow the client to control the direction of the conversation. This will help the mother feel in control of the interactions and help to deepen the connection with the patient. By using these 2 acts, I will begin to establish a therapeutic nurse-client relationship and promote an environment where the client feels able to express positive and negative thoughts. As expected with depression, it may be difficult for a mother to talk about negative thoughts or feelings surrounding motherhood. It is important to be able to create an environment where there is trust and compassion to ensure the mother is able to express how they are truly feeling. Now, it's important to screen for postpartum depression. The RNAO Best Practice Guidelines indicates the Edinburgh Postnatal Depression Scale can be completed any time within the 12 months post-delivery. The Edinburgh Postnatal Depression Scale is a series of 10 questions that aims to evaluate cognitive symptoms of depression. A score of 12 or greater identifies presence of depressive symptoms, and further evaluation of the mother is needed to confirm a postpartum depression diagnosis. As a nurse, it's important to be able to identify an appropriate evidence-based tool that would be best suited for your client. Screening for depressive symptoms should be completed regularly throughout the pregnancy and postpartum. If a client has a positive screen, meaning they've scored 12 or more on the Edinburgh Postnatal Depression Scale, they must be referred for a follow-up comprehensive assessment to confirm the symptoms and severity of depression. Once a client has had a positive comprehensive assessment for postpartum depression, several nursing interventions can be implemented based on the needs of the client. The first step would be to collaborate with the interprofessional team to create a care plan that includes setting goals, identifying barriers to access healthcare services, and considering the client's needs and preferences. This is an area where the client's spouse, family, or support circle can be involved and educated on how to best support the client. Another intervention would be to discuss and promote self-care strategies with the client. These are things that can be done at home and provide the client an opportunity to independently improve their well-being. Self-care strategies should be determined by the client and what best fits their interests and lifestyles. Taking time to themselves allows the mother to de-stress, get away from their responsibilities for a little bit, and improve their mental status. As a nurse, we should also be encouraging the new mother to seek support from spouse, family, or social networks. Nurses can provide information to the client for local support groups where appropriate. Seeking support from others can provide opportunity for the client to have more time for self-care, have someone to talk to when they're feeling overwhelmed, and overall be better able to manage their depressive symptoms. This is also an opportunity for the nurse to educate the client's partner and family on the best ways they can support their loved ones through this time. In some cases, pharmacological intervention is appropriate. It is important as the nurse to advocate for the client and supporting the use of medications as needed. This also includes educating the client on the medications and side effects, as well as discussing the medication purpose and expected outcomes with family members. In some cases, whether it be culturally motivated or personal preference, mothers may want to consider complementary or alternative options. It is important as the nurse to educate these options and support the client in their care choice. Lastly, the most vital intervention is to create a personalized care plan for the client. This includes working collaboratively with the interprofessional team, the client, as well as their support people. Regular follow-up to determine the effectiveness of the care plan is necessary to determine whether changes and revisions are necessary. This will ensure the plan is appropriate for the specific client, changes in response to new developments in the client symptoms, and includes the client's significant people to support their care. In continuing with this client's care, the nurse should create and support a patient or family-centered care model. As the nurse, I would do this by promoting a family-centered approach for maternal and newborn care. I would ensure this by educating the mother's partner or family on how to care for the newborn, such as changing diapers, feedings, and safe sleep practices. This will ensure that the entire family is aware of best practices to care for the newborn to ensure that all of the pressure and responsibility doesn't fall on the mother. This is also a perfect opportunity to create time for the mother for self-care to help with depressive symptoms. I would also support cultural practices as long as they are safe for both the mother and the baby. Providing education to the mother and family about their cultural practices to ensure that they are making educated decisions about their choices. It is important to discuss culture with the mother and the family to ensure everyone is on the same page and advocate for the mother's choice of care. Creating a safe environment and asking open-ended questions about culture will be useful to promote culturally considerative care. By doing this, it can make the mother feel more comfortable with safely incorporating her culture in her newborn's life and will ensure she feels in control. These feelings can make her feel safe and alleviate some of the depressive symptoms. Lastly, focusing on a patient-centered care model, working collaboratively with the care team to create an optimal individualized care plan for a mother with postpartum depression will ensure the best possible outcomes for recovery. I will do this by implementing the nursing interventions previously described. For example, after a positive screening by the Edinburgh Postnatal Depression Scale, I would facilitate a comprehensive assessment with a trained healthcare professional. I would follow up with the client to discuss self-care, provide information on local support groups or forums, facilitate psychosocial or psychotherapy meetings, advocate for medications, and provide research on alternative therapies. Furthermore, it's also important to consider the effects of maternal postpartum depression on the infant. Postpartum depression can affect mother-infant bonding, impair breastfeeding, and lead to long-lasting effects on the infant. It has also been shown that even through recovery, there are lasting effects on the maternal-infant bond. It's vital to include maternal-child interaction guidance and support for specific parenting and child development outcomes within the care plan. This will promote a successful post-recovery outcome for mother and baby. Based on this, it's important to support a personalized care plan and be prompt with follow-ups and care plan revisions to ensure the best possible outcome for recovery. Throughout the nursing interventions and follow-up appointments, the Edinburgh Postnatal Depression Scale can be used regularly to identify changes in the mother's depressive symptoms. In order to determine if the interventions have been effective, the Edinburgh Postnatal Depression Scale scores would be decreasing. Continuing an open dialogue and supporting the expression of positive and negative thoughts, the client may indicate that they are feeling better and that depressive symptoms are subsiding. Using evidence-based research has provided information and skills on how to best care for a mother with postpartum depression. Evidence-based research provides proven strategies for nursing interventions for postpartum depression. Education of the nurse is just as important to educate the client. As a nurse, it is our responsibility to provide the client with information from proven, reliable sources. As a student nurse, I will use the assessment strategies, therapeutic nurse-client relationship skills, and family-centered care model during postpartum appointments. Creating a nurse-client relationship to allow the mother to speak freely, determine if the client has any of the risk factors for postpartum depression, and administer the Edinburgh Postnatal Depression Scale will be needed. As a student nurse, I will also need to know what to do with the information I acquire. With the assistance of my CPS, I will take this information to the senior nurse and make the recommendations appropriately based on the RNAO best practice guidelines.